All right, what's up, guys? My name is Josh Bush, and I'm a second-year student in the Indiana State Doctorate in Athletic Training program. The point of this video is to kind of translate some of the ideas that Jen Sincero brings up in her book, You Are a Badass, and translate those over into athletic training. So one of the bigger problems in athletic training that we have right now is burnout and role commitment, right? And the reason that this happens is that we have all these perceived demands on the profession and all of these desires and needs from our patients and from our supervisors and stuff like that, and just the time that it takes to put in with practice, with providing services to kids at practice, and then doing rehab, and then working in the clinics in the mornings, or kind of whatever. But our complaints they lie in the fact that we don't get compensated for the amount of time and effort that we're putting in. But I just want you, as an athletic trainer, hopefully you're an athletic trainer watching this video, I want you to take a step back and reflect and kind of look at your practice right now. Or look at the last day that you were at your clinical site, wherever that is. I want you to break down your time spent during your time at work. And I want you to write down the things that brought you the most joy and made you feel like you were accomplished, and what things you were just like, gosh, I'm wasting my dang time. Because I guarantee you that you feel like you're wasting your dang time when you're either sitting at practice or you're writing down you're writing your notes up for the day, or something of that nature. And you probably find some pretty good joy whenever you have a patient break through a rehabilitation goal that you guys set. Or something like that. Now, Jen brings up this idea, and it's her concept that she brings up in the chapter called money. And she's talking about how if you want more money, so if athletic trainers want to be compensated for what we do, if you want more money, you got to be willing to take a leap of faith, no matter who's watching you, and just give no cares about what the perceptions are of those around you. Take a leap of faith and just have faith in the universe that when you put all of you and all of your effort into something, you will be rewarded in the future somehow in some way, right? So when we look at those things that we think we're wasting our time with, right, I brought up two different things. I said documentation, and I said sitting at practice. Now, I think that there's a big culture change that we can have with the whole practice deal. Practices should be classified or categorized according to their levels of risk. And if they are a yellow or green, meaning a moderate or low level of risk at the practice, then the athletic trainer should either have to be somewhere nearby, whether they're in the athletic training facility or just in the building or on site, but they don't need to necessarily be at the practice watching your every move. And then if it's green, there doesn't need to be an athletic trainer on site at all, especially if the coaches are emergency care certified, like they're CPR certified and stuff like that. But with your documentation, why do you feel like that's kind of a waste of time? Like, why do you hate documentation? It's probably because you don't take pride in the reasoning behind doing that documentation. As athletic trainers, it's our jobs on the front line to be able to contribute exactly what happened to injury surveillance data and into epidemiology studies and things like that. And it's being able to continue the continuity of care onto other healthcare professions. Like, we need to work interprofessionally, and so in order to do so, we got to have the right documentation to be able to send their way and share our patients' information. And it needs to be detailed, it needs to be clean, and it needs to be done properly, and it needs to be done like you would expect to be done in your physician's office or something like that. Because if not, you're not going to be respected, and if you're not taking that pride in your documentation, you're not going to be compensated for it. And that's time that you're spending, so you might as well make good use of it and actually make it mean something. Contribute to something bigger than yourself, right? Additionally, it's just everything with athletic training, right? So when you're looking back at your day, you saw the things that brought you joy, you saw the things that you felt like you were wasting your time. What's one big thing? What's one big change or one goal that you were shooting for that you set, a couple weeks ago or even that day that you were working towards during that time? What kind of big level change were you looking to make? Was there one? Because if there isn't, then I can see why you feel like it was a waste of time. Or I could see why we have all this burnout and emotional exhaustion that exists in athletic training. It's because we're not taking that initiative to say, I want to improve. I want to get better. everybody around me feels like we don't have enough. So guess what? I'm going to put in what I think is worth the money that I really want to be paid. And so I'm going to take that leap of faith, and I don't care if my coaches, if my athletes, if my supervisor, if my coworkers or my peers or my family, I don't care if they think I'm crazy for doing more work when I have complained in the past that I'm not getting paid enough for the work that I'm doing now. I don't care. It's a leap of faith for a reason. And I'm relying on the universe to compensate me in the future for what I'm really putting in, and I'm doing 100%. So in the end, if I don't get compensated for it, who cares? I'm not putting in more time. I'm being more efficient with my time. And it's because I care more about my job and about my patients and about my profession in general, right? So I'm planning around that practice. So instead of being at those yellow or green risk practices, I'm either working with a patient, trying to help them get better, and so that brings me joy, right? Working with a patient, helping them break their goals and get back to doing what they love. Or I'm in the office and I'm trying to put together or like organize the data that I've collected over the last couple of weeks and see where we're at with injuries, or I'm trying to organize all of my tools that I've used with some of my patients, and I'm reviewing their patient reported outcome measures and seeing how they're changing. I'm doing more things that bring me joy, but also I'm looking at how I can improve my what I'm doing from a patient care standpoint. So am I, like right now personally, I'm trying to make the shift from having my priority set on treatment and rehabilitation and trying to cram it. I work in the secondary setting, so I'm trying to cram it in between when the kids get out at 3 o'clock until they all need to be off at their practices by 4 or 4:30. And so I've got this hour of rehab with 15 to 20 kids that all need something different, when instead my focus shouldn't be on rehab and treatment and trying to make that chaos better for everybody. I mean, that should obviously be something that I'm doing, but that shouldn't be my main focus. My main focus, not during that time, should be developing prevention programs and looking over my data and seeing what prevention programs I can implement across all my sports and each individual population. What injuries are really hindering us? What conditions are coming up more than others? And what prevention measures are out there in the literature that have worked for other people could I advocate for or implement within my own practice? So taking this idea of taking this leap of faith and just allowing the universe to give back to us what we put in it, because we're going to vibrate with positivity. If everybody in athletic training did just that and just didn't care about the stigmas that exist around our job, we push for the brand of athletic training, and we don't give up, and we do what things give us joy, and we take pride in our work. If everybody did that in athletic training, the money's going to come. It's going to come. And if you don't think it's going to come, do it anyway, because what are you doing sitting on your butt watching practice and just being like, wow, what a waste of time? Figure something out to do. Make your time worth it. Take some pride in your job. Take some professional responsibility and make some shit happen, because that is how we are going to be compensated as a profession, and that's how we're going to be recognized and aligned with other healthcare professions, not by saying the S word like I just did, but doing everything else that I said in this video. Thank you.